In this section on our video on pelvic stabilization, we're going to be discussing soft tissue techniques. We're first going to be doing the quadriceps, then we're going to be doing Iliacus Psoas in the supine position, then we're going to turn the client and we're going to be doing the quadratus lumborum and the erectors in the sideline position. Then finally we're going to turn the client prone and work with the client in the prone position for the erectors. First thing I want to discuss with the reasoning of why and which direction our massage will be taking place. In this case, we're discussing the anterior pelvic tilt. In that instance, the quadriceps are shortened. They're in a shortened state. The hamstrings are longer. So if we were to look at the body and the quadriceps are shortened, we would not want to massage the quadriceps more short. We would not want to make the quadriceps take the pelvis more anterior. We would want to go up the front and down the back. So in our theory, we're going to be massaging, up to lengthen the quads, because if the anterior pelvic, just simulate pelvic tilt, if we're anteriorly tilted, the quads would be shortened. We would not want to massage them in the direction of becoming shorter. We want to massage everything in general, to the short to long. Another example, pectoralis. If our pecs are short this way, we would not want to massage the pecs this way. We would not want to massage the pecs to open them and adding length to something short. So the theory is any muscles that's short, you want to lengthen. Any muscles that are too long, you want to shorten with massage as well as exercise. So the first technique we want to do here is in the quadricep region. Very little oil for myofascial. So again, the technique is up. And we want to do some broad strokes initially. Then we're going to be doing some more direct. And we kind of want to do it slow and teasing the fibers as we go. Teasing these fibers as we go. From the insertion to the origin, in this case, to lengthen, to hopefully get a pelvic derotation. Up. Up. So we want to massage these quads slowly in the direction upward. We'd also want to work the patella tendon or the patella ligament around the patella to loosen all the fascia around the patella. Pressure upward for the quadriceps. Okay, that's pretty general. Next, we want to engage iliacus and psoas. Iliacus and psoas should be massaged in a no pain, theory. We do not want to, give pain into the belly, resistance and things. There's ways to do it. We're going to, not now, but we're going to have the client bend the knee. We're going to come with the pads of our fingers into iliacus, gently. Pads of our fingers. And then we're going to slightly pull up to loosen all that extra fascia that's in here. And we're going to come, and as they lengthen their leg down, we're going to do a little myofascial release. So the pads. We are also now going to do the psoas major. We're going to just turn our hand sideways so our pads of our fingers are now on psoas. This should be pain-free, or on a pain level of 2 or 3 only. You hear an NMT seminar, 7 or so, pain. That's too much. You don't want the body to tighten and resist. If there's an anteriorly pelvic tilt, the iliacus is short this way, psoas is short this way. So we want all our pressure, all our techniques to go upward and lengthen, okay, to take the spine back into its normal position and also the pelvis back in its normal position. So we're going to be doing inhale. When they inhale, they exhale. You come in and you're going to be doing the pads of your fingertips right onto that iliacus. As your leg comes down, you're going to lengthen that fascia for iliacus. Gently, pads of your fingers are now going to be on psoas, and that same theory applies. Leg is bent, down and into the psoas as we go. Very gentle. So let's try that. So we're going to have the client bend the knee. We're going to find the anterior superior iliac spine on the side that you're working. We're going to be doing the pads. So I like to just place my hands there. That way their body knows where my hands are. It's not a shock. Don't dig in right away, pushing real hard. Let their body get used to what you're doing. I'm going to come in gentle. And now my fingers, the pads of my fingers, are engaging the anterior iliac fossa to which the iliac muscle is. And she's going to inhale. Okay, now I go in a little deeper. The exhalation with the pads of my fingers. She's going to come down with her leg, come down slowly. Toes up as you go, and we're going to do a little fascial release. We're going to bend the leg again. Let's try it one more time. Gently make contact as to let the client's body know what you're doing and getting accustomed to it. The person inhales, and then exhale, and then we engage that anterior iliac fossa. They come down, and then you're going to do a little traction cranially with my left hand in this case, and toes up to engage the tissue, iliacus. Psoas. Remember, psoas is pretty lateral. All you're going to do is take your hand, and we're going to come under and flat. Under and flat. And we're going to down. And toes up. Let's try that again. You may need to ask them for a little bit more space. Is that okay? You always ask for permission before you engage with anybody's body. We're going to come under or lateral to the abdominals. Wait for them to breathe. Okay, inhale. Now the flat part or the tips of my fingers, relax. Relax, dear. You're fighting a little bit. She's fighting. Am I hurting you? No. She's a good test. Okay, so now I'm on psoas. They can lift their knee up. Lift your knee up. That tightens psoas because psoas is a hip flexor. That ensures that we're on the muscle. Now down. And then I kind of gently do an opposite motion. Feel it. Okay, so let's try all this again. Iliacus and psoas. We're going to be finding the anterior superior iliac spine. We're going to be pads of our fingers. Relax. Inhale. Nice this time. She's relaxing more. And then once we find it, we're going to engage and they come down. As they come down, then once the leg straightens out, toes up, toes up. Okay, good. Even the foot can come up. Bend the leg. Now we're going to do psoas. I go with their breath. Wait for them to inhale. They exhale. That allows us to come in. Okay, and then down, dear. And ankle up, toes up. Very good. So that was quadriceps going in the direction of derotation. Iliacus going in the same direction of derotation, and psoas. So hopefully these three will engage the derotation aspect.